Thank you. I'm an associate veterinarian at the Indianapolis Zoo, and I'm going to briefly describe to you our now 5 cases of EHB that we've had in our African elephant herd. These cases all occurred over a 4-month time period from March to July of this year. Our first case was Naya, a 6.5-year-old female. She presented with some vague clinical signs, including lethargy, a decreased appetite, some abdominal pain, and loose stool. Blood work at the time just showed evidence of mild dehydration, so we attributed this to a mild colic episode, which we had seen in this elephant previously. We started treatment with supportive care, anti-inflammatory, and pain medication. By the second day, her clinical signs had worsened significantly. She was depressed. She now had hematuria, diarrhea, vomiting, tremors in her hind limbs, as well as sclerohyperemia and skin ulcerations. Her blood work had also changed dramatically. She now had severe dehydration, evidence of acute inflammation, a severe thrombocytopenia, and acute renal failure. She also had elevated liver enzymes. At this point, we started treating her with IV and rectal fluids, broad-spectrum antibiotics, and continued the anti-inflammatory treatment. On day 3, she was severely depressed. She had dyspnea, marked abdominal distension, and sub-Q edema in the head and forelimbs. The blood work abnormalities from day 2 were also significantly worse. This elephant unfortunately expired in less than 72 hours from the onset of clinical signs. Now, when this case was occurring, EHV was not even on our radar. It wasn't even on our list of differentials. Having never had Asian elephant calves in our herd, it just wasn't something that we thought about. So our gross necropsy findings were pretty classic for EHV. We saw hemorrhage in multiple organs, as well as mucosal ulcerations externally and within the GI tract. Just a couple more gross photos there, pretty remarkable. We didn't receive histopathology for several weeks, but we did see disseminated vascular necrosis with edema, hemorrhage, and those endothelial cell intranuclear inclusions that Callie mentioned earlier. This picture just shows some hemorrhage within the myocardium. And then this is from our pathologist, but those are those intranuclear cell inclusions typical of the herpesvirus. So we were fortunate enough that Aaron Latimer actually reached out to us after hearing about the death of our elephant and said, hey, this sounds like it might be EHB. So we went ahead and submitted some banked whole blood samples to her, and sure enough, Naya had a very significant viral load of 2 to 3 million. And as she mentioned earlier, Naya's frozen tissues were used to complete the whole genome sequencing and identified this strain as EHB3A. Unfortunately, 1 week later, our other young calf, Kalina, a 7.5-year-old female, also became ill. She presented with loose stool and hematuria, but her initial blood work was much more severe than Naya's. She already had acute inflammation, a monocytopenia, and a significant thrombocytopenia. We began treatment with antivirals immediately, as well as pain medication, rectal fluids, and broad-spectrum antibiotics. On the second day, her clinical signs progressed. She became lethargic, she stopped eating, she had a very stiff gait, and at this point she had just frank blood in her urine. We also saw worsening of her blood work parameters. Her platelet count got severely low, and she also had evidence of acute renal failure and electrolyte abnormalities. On the third day, she was depressed. She had developed edema along her ventrum and her hind limbs. She had some tremoring in her trunk and some pretty significant diarrhea. We attempted more aggressive treatment with plasma transfusions and steroids, but unfortunately by the morning of day 4, she had significantly decompensated. She was severely tachypneic, tachycardic, and had frank hemorrhage from her rectum. She also expired within less than 72 hours of the onset of her clinical signs. These are just some photos from her gross necropsy, again showing significant hemorrhage and ulcerations in multiple organs. We also submitted some whole blood samples on her, and her viral counts were significantly high, from 1 to 3.7 million. Prior to these two cases, again, we were not surveilling for EHV. So after this occurred, we reached out to all of our colleagues in North America that are dealing with EHV in Asian elephants to figure out what we should be doing to monitor the rest of our herd. So we adapted some protocols from other zoos to develop our own surveillance program. Our two youngest animals at the time were 12 and 13 years of age, and we considered them to be at the highest risk. We started testing them for EHV twice weekly, and we were testing our adults once weekly. We also performed once weekly routine blood work, CBC and chemistry, in our two young animals, and monthly blood work in our adults. In addition to the blood work monitoring, we were looking at trunk wash samples as well as routine urinalysis. It's fortunate that we started doing this because less than 2 months later we had our third case, and we would not have detected this case had we not started our surveillance program. Kadar was a 13-year-old male who presented with loose stool and lethargy. His initial blood work showed a mild anemia, monocytopenia, thrombocytopenia, and we also saw a marked increase in his acute phase proteins. These were 200 to 300-fold what was considered baseline for this animal. And as Lauren mentioned earlier, it was really important to establish normal reference ranges for each individual elephant, because Kadar's blood work values were not outside the normal reference range for African elephants, but they were outside the range for him. So we had a chart of his normal values that we could detect those subtle changes. So he had a pretty low viremia on day 1, only 5,000, but as you can see, it climbed rather quickly within 4 days to 265,000. We treated him much more aggressively than the first two cases because this time we knew what we were dealing with. He received multiple plasma and whole blood transfusions, broad-spectrum antibiotics, anti-inflammatories, gastroprotectants, famciclovir, as well as aggressive fluid therapy, vitamin C, and stem cells. We were lucky enough to have 2 older, very compliant elephants within our herd to be donors for these sick elephants. So we were able to do multiple blood collections of up to 40 units at a time, and the elephants just stood there for it without sedation. This is Kadar on the restraint device receiving a whole blood and a plasma transfusion. So Kadar's viral load peaked at 265,000 on day 4, but it was negative by day 16. We saw the most severe changes in his blood work on day 6. We started to see clinical improvement on day 7, and his platelet numbers started to increase. By day 10, the elephant was considered back to normal behaviorally. We continued to treat with famciclovir until day 25, and we finally discontinued it. However, we still were monitoring his routine blood work and CBC on a daily basis for any changes. We did that up until day 36 when we finally felt comfortable returning to our normal surveillance program. Less than 2 weeks from Kadar's onset, we had our 4th case. This was a 12-year-old female, Zahara. Interesting thing about Zahara is that she had absolutely no clinical signs. She was behaviorally normal, and her blood work on day 1 and 2 was also completely normal. We had been testing her daily because of the active infection in Kadar, and that's when we picked up her viremia. She started at 21,000 on day 1, but by day 3 it was already up to 115,000. It was also on day 3 that we started to see abnormalities in her blood work, a severe thrombocytopenia, a band neutrophilia, mild anemia, and an increase in those acute phase proteins. It wasn't until day 5 that she actually developed some clinical signs, which included lethargy and loose stool. She received similar treatment to Kadar with aggressive transfusions. We began with plasma, and then as her blood work parameters worsened, we switched to whole blood, and she received 6 whole blood transfusions. She also got antibiotics, anti-inflammatories, gastroprotectants, antivirals, and fluids. Her course of illness was very similar to Kadar's, with her viral load peaking on day 5 However, she reached a much higher level of 1.1 million versus his 265,000. We saw the most severe changes in her blood work on day 6, but those returned to normal by day 14. By day 8, she was considered clinically normal, and we continued to treat her with famciclovir until day 25, but continued to do daily blood work monitoring until day 37. This is just a graph showing you the qPCR results for both of them, and you can see Zahara's reached a much higher level than Kadar's, but they both peaked around the same time, around day 6. After the first 2 cases, we were also running trunk wash samples on the entire herd to see who was shedding and when. The first star here is when the viremia was first detected in Kadar. And as you can see, he was shedding a very high level in his trunk wash at that same time. And several other elephants in the herd were also shedding in their trunk washes at that time. The second star is when the viremia was detected in Zahara, and the only elephant shedding in the trunk wash at that time was Kadar. This last case is the one that really surprised us. It was a 37-year-old female, Ivory, and she had a low-level viremia detected initially. And she actually did have some clinical signs. Before we got qPCR results, the keepers had called and said that she was moving slower than normal that morning. So we went ahead and ran her complete blood count and saw a 40% reduction in her platelets. She also had elevation in serum amyloid A, and we started treatment on her with famciclovir, antibiotics, anti-inflammatories, and fluids. Her viral load peaked at 12,600 on day 3, but by then we had a marked reduction in platelets of 63%. Luckily, this was a pretty short illness, and she recovered quickly. Her viral load was undetectable by day 10. So, as others have reiterated, what we've learned from all of this is that surveillance is of utmost importance. We would not have detected or saved those following 2 elephants had we not been monitoring. Clinical signs may be absent or subtle, and you need to be prepared to provide early and aggressive treatment. And I think the thing we were most lucky about was the fact that our elephants were well trained to tolerate these treatments, and our staff were incredibly dedicated and put in very long hours to pull these elephants through this illness. And had we not had that training in place, we would not have been able to do this. That is all that I have.
We have time for questions.